Hello everyone, this is Dr. Shishma Sarilla, consulting homeopath at Fidicus Homeopathy. Now we will be discussing why this insulin resistance is happening in PCOS. So we'll discuss about each and every factor here in this slide, how insulin resistance is caused by PCOS. Remember, PCOS can cause insulin resistance, and insulin resistance can alter the androgen levels in your body, and that can cause hyperandrogenism. Hyperandrogenism will again cause insulin resistance. Again, insulin resistance will cause hyperandrogenism. This is a cycle. Okay. So the first thing why PCOS can trigger or can cause type 2 diabetes or insulin resistance is because of the genetic predisposition. For example, say I do not have any family history of PCOS or diabetes. So my gene is ABCD. For example, there is another friend of mine who has a family history of PCOS along with type 2 diabetes, but mine is ABCD, right? She can be ACBD. And because of that genetic mutation or that genetic formation in the genes, that can be a predisposing factor for insulin resistance to form in the body. And second thing is lifestyle disorder, which is very common these days, especially people who are doing desk jobs, like people who are software engineers or people who are working in industry where they are sit for a longer period of time are more prone for type 2 diabetes. So why they are prone for type 2 diabetes? They do not walk for a period of time. Like for example, they go at 9 o'clock, they sit from 9 o'clock to 5 o'clock or 9 o'clock to 6 or 7 o'clock. They have stress during their work, first thing, and there is no motion of legs, only hands are working and brain is working. The muscles are not working. The muscle, apart from brain, the muscle is the organ that consumes a lot of blood glucose when it is working. So it is not working, so blood glucose level is sustained. Cortisol level is there in the body because of your stressful desk jobs. That will maintain the blood glucose level, and this can trigger insulin resistance. So having disoriented lifestyle and also central obesity, people who sit feel hungry a lot because they do a job that requires a lot of mental attention. Brain consumes a lot of glucose, so they feel hungry very faster. And also because they just sit and do work, they do not have any sort of happy hormone releasing workouts do release happy hormones, so they do not have that. There is continuous rise of cortisol, which will make you hungry also. So that is happening. The central obesity is there, and disoriented lifestyle, bad sleeping habits. People who do not sleep before 9 p.m. are more prone for type 2 or lifestyle disorders. And then we have hormonal imbalance. The hormonal imbalance in PCOS, especially, you know that in PCOS we have luteinizing hormone, which is more than follicle stimulating hormone, right? This luteinizing hormone will stimulate the thecal cells, which will release androgens. Androgens can cause some slight modifications in the receptors or in certain parts of the receptors, which can cause glucose or this insulin resistance. So that is there. And then hyperinsulinemia, we have already talked about it. Apart from that, you should also understand that in PCOS, sometimes what happens is PCOS, especially which is stress induced, the cortisol level is always there in the body. So during cortisol level, a lot of food that you're taking is converted into fat, and in fat there is a metabolization or there is formation of an hormone called as E1, which is estrogen 1. The hormone that we females need is estradiol, which is E2. So E1 is formed. There is estrogen dominance, which can trigger insulin resistance also. So fat is there, estrogen excess is there, and then there is insulin resistance. So it can also cause insulin resistance by altering things. And then we have other contributing factors in the receptor. Slight changes like phosphate change, little changes even in the atomic level also can cause the receptor to break down or to form into a different substance or to form into a different shape, which does not bind to the insulin. Then if you are under stress and if you are facing PCOS and you are having bad life cycle or bad lifestyle, you can understand that the body will start to deteriorate. Okay, so that is called a syphilitic miasm in homeopathy, where the body will start destroying itself. How is it starting to destroy itself? It can show in the form of vitiligo, where your melanocytes are destroyed. It can show in the form of rheumatoid arthritis, where your joints are destroyed. It can show in the form of systemic lupus erythematosus, where it is multifactorial in nature. You can also suffer from psoriasis, which affects the skin and also the joints also. So whenever you are under stress, what happens is that I told you that the receptor is in a certain shape. For example, we are taking it as a triangle shape, right? So what happens is the insulin is inverted triangle, right? Body makes its own antibodies where it will either destroy the insulin or it will come and bind to the receptor just like insulin is binding. But remember, this will not allow the glucose to go inside. So the insulin is there, the glucose is still there, but the receptor are attached to the antibodies. So this is also a body's way of destroying itself. That can also occur in PCOS, especially if you're under stress and bad life cycle. And you have to compulsory note inflammation. People who are eating a lot of red meat, consuming a lot of dairy products, are completely under stress, having IBS, can also have this inflammation in the body. And if you're eating a lot of inflammatory foods, that can also trigger or imbalance out the insulin level, which can cause insulin resistance. If you're someone who's suffering from PCOS, insulin resistance, type 2 diabetes, or any other female related problems, you can contact Fidicus Homeopathy. Here we have two kinds of consultation options. One is the online consultation option and the second one is the offline consultation option. If you're someone who's staying nearby us, you can contact us offline. If you're staying far from us, you can contact us online either through audio consultation or through video consultation. And after consultation and the investigations verification, especially to the online clients, the medicines will be sent to your doorstep. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. If you're staying elsewhere across the globe, it can take 48 business days for our medicines to reach your doorstep. If you want to get in touch with us or contact us or take a doctor consultation, or if you have any sort of queries, we are here to help you out. You can contact us on this number, messages or WhatsApp us. And if you want to know more about Fidicus Homeopathy, please do check our website www.fidicus.com. We have discussed how homeopathy is the best choice of medicine for treating PCOS or these lifestyle disorders. As such, so why should you choose Fidicus Homeopathy? Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First and foremost thing, and very important, is that we have already having good success rate in treating PCOS, PCOD, female related problems. And apart from that, the transparent treatment, that is, there is no gray area between the patient and the doctor. We will be clearly stating you about your prognosis. And the personal care here at Fidicus is top notch. Here we will be answering all of your queries, and also if there is any sort of myths that you have continuously put into your head, we will be busting all of your myths with the facts, and we have qualified doctors here. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.